Thank you for joining us here on the KAMR Local 4 News. The City of Amarillo is preparing to have a briefing about the coronavirus pandemic. Let's go and take you there live for this breaking news.
Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Michael Emmentier, Chief Medical Officer for BSA. Foy Garza of the Amarillo VA, and City Manager Jared Miller. What we'll do is I'll open it up here and for a brief statement each of the panelists, and then we'll go ahead and take direct questions from the media. At this time, I want to go ahead and open it up to Amarillo Mayor Ginger Nelson.
Good morning, everyone. As of 2 days ago, the governor has taken out of our hands the decision of whether or not to reopen our city, as he has decided to reopen the state of Texas. So we are going to follow the governor's orders, of course, but I want to affirm that right up front. And starting Friday, there are some businesses in our city that will be able to open at 25%. These reopened businesses fall in these categories: retail stores, restaurants, movie theaters, the mall, museums, libraries, offices where individuals work alone, and golf courses. So if your business falls in those categories, then you will be subject to the 25% occupancy restrictions, but you can consider whether or not you can safely open. If you were an essential business under the governor's previous order and you were already open, those 25% occupancy levels don't apply to you. The city will keep in place a disaster declaration. And some people are saying, well, why would we do that? Why do we still have an order if the governor has taken it out of our hands? Well, our order will mirror the governor's provisions. So we will do exactly what the governor has ordered for the entire state of Texas. But it's important for us to have that order in place because it is a threshold requirement to getting federal funding, to disaster funding, and also state funding. And so any funds that are coming from the government to help us address COVID expenses or response expenses, we've got to have that disaster order in place. So that's the explanation, plain and simple, is it's going to tie down to the funding options that we might have. I do think that Amarillo has had a good response in how we've handled COVID. I'm very proud of our team under the city manager's leadership and the health department, certainly, and Dr. Milton. I'm very proud of the efforts that they've made. I'm also very proud of the approach that the city council took. We had as friendly a business approach as we could. We had the low risk category there until April 17th when the governor restricted that. And so I'm hopeful that just as we in the initial stages of responding to COVID gave as much freedom as we could to business owners, and our business owners and our customers responded responsibly to that, I'm hoping that now as we respond to reopening, that we will, as business owners and as customers, we will be extra responsible in our individual behavior. I do have a concern that our numbers are still climbing. We have a couple of hot spots in or around our city, and those hot spots have certainly surged our numbers, especially in Potter County. Our graph has not leveled off in either county. And so while our hospitals are not critical in their population yet, those numbers have grown in the last week. And I'm worried that if we as individuals don't make the right choices, we could be facing a dangerous situation here in our city as far as the outbreak is concerned. So how do we address that concern? Well, first and foremost, I'm asking you as citizens to stay in as much as possible. If you must get out, then please wear a mask. And you're not just wearing it for you, you're wearing it for everyone you come in contact with. You might be carrying the virus and not even know it. So you're doing it as an act of love and concern for your neighbors that you're going to encounter when you're out and about in the city. Let me tell you what the city council is doing specifically to address this concern. We right now have an open dialogue going with the governor's office and with his medical team. So we are today sending a list to the governor's office requesting extra supplies, extra hands, and Casey may speak in a minute as to what's going to be on that list. But we are asking the governor to send us extra help and extra supplies here to the city so that we can work on those hot spots, we can get a better control on our numbers. And I want to say, I really appreciate the governor's chief of staff, Louise Sines, who has had more than one phone call with me after hours in trying to address this and make sure that our city can reopen safely. And also want to say how much I appreciate the leadership and the service of Mark Bivens, who's serving on the strategic task force for the governor for Reopen Texas. And Mark has been vital, has given so many hours in the last 10 days to helping me navigate this situation on a statewide level, and just the service that he's giving our state on that committee. I want to call to your attention also that we as a city have changed the report card, the way we're reporting the data. We're learning as we're going. This is a fluid situation. And so part of what our main goal on that report card is that you as a citizen can quickly see where we are with our statistics. So two of the changes that I want to highlight for you are that we're now adding a column that will show you the number of people who've recovered, and we're backing that number out. So you're getting to see, these were our positive tests, these are the people that have recovered, and the difference of that shows our active cases. And we're also showing you in a column all by itself what the difference was from yesterday. So what's our one-day jump been? Because that's a number that's really critical for us to keep an eye on. Hospitalizations and where most people, Casey, maybe you'll talk about this, but I think the number's around 90% of the people who test positive for the disease don't need hospitalization. So we're pulling that data off. There was a column there that said, are they recovering at home? Are they recovering in the hospital? And we're changing the way we want to report that data. It's no longer on the report card. Hospitalizations are very important though, and that's a data piece that we want citizens to have. So we are revamping, not the report card, but we're adding extra data and hoping to be up with that on Friday, creating a dashboard that will have a whole lot more data that citizens can look at, and hospitalizations will be part of bringing that dashboard online. So it really comes down to our choices, Amarillo. Our choices as individuals and our choices as business owners. If the governor has opened your business, then I'm asking you to take the reins of responsibility and analyze for yourself. Is it safe for you to open? Is it safe for your employees, for your customers? Is it wise for our city as a whole for your business to be open? How do you need to operate your business? What changes do you need to make operationally in order to be safe and be open? I would ask you to consider especially what the medical experts on this press conference are saying. Listen closely to the data. Check Amarillo alerts every day so that you can stay engaged and informed about what our numbers are doing in the city. How will you count people as they're going in and out of your store? If your store's at capacity, how will customers know that? How will they wait without creating a line or congregating in a hallway or foyer outside your store? Or just be thinking about the practical things in addition to what's published in the Reopen Texas report for your business. Think practically about how people are going to interact in your business, and let's make sure that we don't congregate them, certainly in a confined space, but even outdoors, plenty of room for them to spread out and know how to stay safe if they want to shop in or do business in your store. What we need from Amarilloans as individuals, we need you to be wise leaders and to govern yourselves as much as possible with respect to knowing you could be carrying the disease and not even know it. So staying home is still the best approach. That's the best social distancing that we have. If you must get out, keep in mind 6 feet distance from everyone that you're encountering. Please wear a mask. You're not wearing it for yourself, you're wearing it for others. So I know I have some folks even in my family. It's very important to them to be able to say, I'm strong, I don't need to wear a mask. And I continue to say, it's not about you. It's about the other people that you're encountering. So please wear a mask. It's part of being a good citizen. It's not forever. It's just for this temporary season while we're fighting COVID and while we're getting on top of having the medicines that we need and the vaccine. We're asking you as a good citizen to please wear a mask. Please don't gather in groups, especially indoors. If you must meet, outdoors is better. But consider, if you really must meet, I want to end my comments today reading directly from the governor's order. He specifically said, every person in Texas shall, not may, not should, but shall, except where necessary to provide or obtain essential services or reopen services, they shall minimize social gatherings and minimize in-person contact with people who are not in the same household. So the message is clear. It's clear from the governor's office, and I want it to be clear to you today here in Amarillo. It is still very important for us to try and stay in and to keep ourselves distanced from each other. So we're beginning to reopen, but let me be very clear. This is not the all clear back to life as normal. So we've got to be careful and responsible. And I believe in you, Amarillo. I believe that we can do this and we can do it safely. But I'm asking for your help and for your cooperation. Thank you.
Thank you, Mayor. This time we want to go to Casey Stoughton, Public Health Director, City of Amarillo.
Good morning. As of 10 o'clock today, there were a total of 654 cases of COVID-19 in Potter and Randall counties. That was an increase in 24 since yesterday. We will have additional cases on our 2:30 report card. We have a total of 449 cases in Potter County and 205 in Randall County. We do have a total of 102 recoveries, and that's excellent news, which leaves us about 520 active cases. There are a total of 11 deaths reported in Potter and Randall counties. Drive-through testing still continues today. The drive-through testing site will be open until 3 o'clock. So if you have symptoms and would like to be tested, please call 378-6300, and our call takers will screen and direct you for testing. Mayor Nelson described our report card and the changes therein really, really well. We did make some changes. We heard feedback from our council and from our community and wanted to make those changes that we heard from our community with the information that we thought that would be very helpful for you. It's important to know that the net change daily is what is in that very last column on the report card, and that's a net change from the day before. And so we, as Mayor Nelson told us, we take the total number of cases minus the recoveries minus the deaths, and that gives us the active cases. And then the net change is the new cases minus that, the active cases minus those new cases every day for a net change every day. We will have a new dashboard soon, and so we'll be able to have lots of new data elements that you can see, and that will be helpful. It will include hospitalization data, and so we're working with the hospitals to get that information so that it's very relevant and very helpful for our community. I think that will be great. We have spoken with some businesses already about what it looks like for their business to reopen and whether or not it's safe. Every time we get new groups together, it increases the risk. And so we want you to, just like Mayor Nelson said, to consider that for your business. So we appreciate everyone's thoughtfulness. Staying away from large groups is the very best way to stay safe right now. So please continue to wear your masks and stay home as much as you can. That's all I have today, Dave.
Thank you, Casey. This time I'm going to go to Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center.
Yes, good morning. I just wanted to reiterate what Mayor Nelson and Casey have said about continuing to practice social distancing and washing your hands, and please wear a mask when you're in public and avoid congregating. That's just going to be most important as people are going to get out more. In terms of our convalescent plasma clinical trial, we're up to 21 doses delivered, and it looks like we have 6 potential local donors that could be scheduled in the next few days. Other than that, I think I'm going to leave it up to Dr. Weiss and Lamentier to comment on how the hospitals are doing. I certainly speak with them on almost a daily basis, and I know that the numbers continue to rise some, and so I'll let them go ahead and discuss that.
Thank you, Dr. Milton. This time we want to go to Dr. Brian Weiss, Chief Medical Officer, Northwest Texas Hospital.
Hi, good morning from Northwest. So yeah, as Dr. Milton, I said, let's start with the numbers first. So we we have 48 positive patients in the hospital right now. And that's the highest number we've had. And that being said, we have 10 patients under investigation. And I know all three hospitals have benefited from having some of the in-house testing to be able to more efficiently move people from the person under investigation category to either a positive or negative. Right now, we have 43 of our 62 dedicated ICU beds occupied. So still some resource there. The number that caught our attention today is we have 28 ventilators working or functioning right now. And that's up from 22 yesterday. Now, the reason that's important is it was published that Northwest has about 40 ventilators available at any given time. However, out of those 40, we typically have 8 or 9 that are strategically parked around the hospital where emergencies could arise. So that gives us only 3 or 4 ventilators right now readily available to take care of COVID patients without having to rob from those strategic spots in the hospital. So that's caught our attention. We're managing that situation right now. In terms of PPE, we have continued to reutilize N95 masks by the use of UV light, but gowns have become an issue. And kind of surprisingly, because gowns for us come typically from South America, but we've had a relative shortage of gowns. We're looking at ways of reutilizing gowns now and re-sterilizing them so we have those available to our staff, both hospital and medical staff. In-house testing, I know, has been a topic. We received about 180 tests last week for in-house testing. We've chewed down to about 75 left right now. So we've been having to use them very judiciously. We do anticipate hopefully a shipment coming in the next day or two that will significantly increase our in-house testing. That really helps us efficiently move these patients from PUIs to either positive or negative patients. Big thing is on a daily basis, we are seeing positives coming from the meat processing plants and from the Texas Department of Criminal Justice facilities. So those continue to be hotspots. And I do want to reemphasize what the mayor and what Dr. Milton have said is our concern is now with the opening of some of the services in the city, people are obviously going to be excited to go out and kind of get somewhat back to normal life. But what we can't do is make Amarillo, the city itself, yet another hotspot compared to these other facilities. And I think the mayor and all her team have done a great job of keeping the positives in the city at a low rate. We have to be careful about not letting that rise, because between the meat processing plant and the prison, we really can't afford to have another source of positives coming in without overwhelming the resources we have right now. So that's kind of where we stand at Northwest as of this morning. Thank you.
Thank you, Dr. Weiss. Now I want to go to Dr. Michael Lamentier, Chief Medical Officer, BSA.
Good morning. Thanks for letting me join the call today. I appreciate being on. Couple things. First, I'll start with our statistics today. As of this morning, we have 27 positive patients in-house. About 50% of those are requiring ICU level care. And of those requiring ICU level care, about 75% of those are on the ventilator. We currently have 19 total patients on the ventilator when you look at both COVID and non-COVID categories. And that's about 60% of our ventilator capacity. That's those devices that we look at as traditional ventilators. But I think as we've mentioned before, both hospitals are looking at opportunities where we could surge using some non-traditional ventilators as ventilators, things like anesthesia machines and BiPAP devices. And that would really translate to us using about 25% right now of that total potential capacity. Again, that would not be an ideal scenario, but still gives us the ability to surge up if necessary for patients requiring that level of care. We are requiring about 42 or utilizing 42 of our ICU beds at this time. Out of our total 48 that are our traditional ICU beds. We do have a surge plan that allows us to go outside of the traditional ICU walls to create more beds if necessary for patients that require intensive level care. We currently have done a significant number of tests. As of yesterday, to give you the accurate numbers, we did 770 tests to date since the beginning of this pandemic here in our city. Of those tests now, 20% have come back as of yesterday as positive. This includes both inpatient and outpatient testing that's been done. That's significant because a week ago, we were reporting 13% of all of our tests were coming back positive. So we've definitely seen a jump over the past week in the number of positive results we're getting back of all the testing that's performed. I would concur with Dr. Weiss that the rapid PCR testing on our in-house Cepheid device is letting us, it's really a game changer for us. It's letting us turn results around on those patients under investigation very quickly. We are running low on those tests, but have another order that's supposed to come in this week. And again, that's been under an allocation basis. So hopefully we'll get those testing kits in, and certainly that allows us to do things much more efficiently in the hospital in terms of how we conserve PPE and how we quickly demarcate someone as either being under investigation and now positive, or ruling them out as negative. From a PPE standpoint, we are in fairly good shape. We have started decontaminating our N95 masks using our STERAD devices, which use hydrogen peroxide, which is prolonging the life of those that can be prolonged with only a certain number of cycles that you can do for one mask, for instance. I would like to say that in light of the governor's order in terms of reopening the city, I share the apprehension that is shared by the mayor, by Dr. Milton and Dr. Weiss, and that is that it may be reasonable to do so in a very limited capacity and doing so wisely. We should still be masking when we're out and about in close contact with individuals. We should still be attempting to have that appropriate social distancing so that we're not increasing the risk for another surge in our community. When it comes to the hospital's look at opening more liberally with elective procedures and surgeries, we are taking that very seriously. We're looking at that on a daily basis. Based on the numbers in our community, we are not ready to go back to normal operations at this time. We are attempting to follow the CMS guidelines, the guidelines that have been put forth by the CDC, and also the American College of Surgeons in terms of what needs to be happening in your community to allow you to determine how you can resume operations closer to normal. We've established a surgical subcommittee to help us review cases to determine which ones can be put off for a brief period, which of those cannot be put off. And again, attempting to make very good and informed decisions with our physicians that are doing these procedures, as well as their discussions with their patients, so that we do not delay surgeries or procedures that cannot be delayed and should not be delayed, but that we also are putting off those things that are not urgent or semi-urgent to proceed at this time. And that's my summary for today. Thank you.
Thank you, Dr. Lementier. This time we're going to go to Foy Garza and the Amarillo VA.
Hi, good morning. So as of this morning, here at the Amarillo VA, for the first time in a long time, we do not have any positive cases in-house, nor any PUIs for that matter in-house. However, we continue to monitor approximately 3 to 4 confirmed positive cases of patients who are at home on home quarantine. We do have some good news though. On Monday, we did discharge our first COVID positive patient, 83-year-old male Army veteran who spent 35 days in our inpatient unit, who was discharged on Monday with great fanfare from his family, from our workforce, and some of the members of the media to a rehab facility in the community. And I'm happy to report that the worst of this virus is now behind him, and he'll be at home resting with his family here very soon. We're also in the process of activating our 4th mission per a regional request to serve as a potential overflow alternate site should the community hospitals hit capacity in the near future. And I just want to mention that, we stand ready to support our local community as always. Our in-house testing has also allowed us to continue to screen our long-term care, our nursing home patients, and our staff. And thus far, we've tested 99 of our nursing home residents, in addition to over 250 of our employees who are working every day at our community living center / nursing home. And all of them at this point have come back negative, which is a great thing. However, we're going to continue our surveillance strategy and testing moving forward for this special population. While our healthcare system has not experienced additional positive cases, we still continue to schedule 100% of our face-to-face primary care, mental health, and specialty care appointments to virtual options, and only appointments deemed urgent will be scheduled for an inpatient visit. Our partnership with the Baltimore VA and Mayo Clinic is formalizing at the moment, and we're excited to provide some convalescent plasma treatment options to our veteran patients in the very near future. As always, should any of our veterans patients begin experiencing any flu-like symptoms, we're asking that they call ahead before visiting any one of our sites at 806-355-9703 and press option 2. Again, that number is 806-355-9703 and press option 2. In closing, my time as interim director for the Amarillo VA is coming to a 4-month end at the end of this week. And I just want to take a quick minute to recognize the dedication, commitment, and resiliency of our workforce in addressing and meeting the needs of our Panhandle veterans for stepping up to this incredible challenge to combat COVID-19. And I want to thank our community partners at our community hospitals and leaders and frontline healthcare personnel too, who are working every day 24/7 and in the face of such uncertain times. And I want to thank Mayor Nelson and the City of Amarillo Public Health Department for allowing us to speak to our veterans and their families here in the Texas Panhandle. So thank you.
Thank you, Foy. At this time, we now go to City Manager Jared Miller.
Thank you, Dave. As a reminder, the city recently announced a new emergency notification system to provide current and factual information on a variety of events, including COVID-19. I want to encourage citizens to continue to sign up for the service at amarilloalerts.com so that you can stay informed. As of this morning, we have 5,051 people signed up for these alerts. I want to echo what Casey said and just remind everyone that the drive-through testing center is still open. If you feel sick and have symptoms you think may be COVID, call the public health hotline at 378-6300 to be screened for the drive-through testing center. With regard to the pet pantry, yesterday we moved the pet pantry to Thompson Park in order to address some traffic safety concerns at the animal management welfare location. It was extremely successful and a very safe day with 488 people served. We had over 400 of those people served within the first hour, so the park functioned perfectly and kept people out of traffic and in a very safe condition. The pet pantry is going to be open again tomorrow at Thompson Park. I want to continue to thank Merrick Pet Care for their partnership in providing the food for this essential program. Without Merrick Pet Care, we couldn't be doing this. I'm not doing a commercial for them. It just is that important to this program. Finally wanted to provide an update on the state executive orders. The governor's issued 3 new executive orders that are going into effect over this week. Currently under the governor's order GA-16, that's going to expire on midnight tomorrow. Customers may not go into any non-essential retail business per guidance issued by the DSHS, Department of State Health Services. Beginning at midnight on May 1st, or beginning at the morning, 12:01 on the morning of May 1st, which is Friday morning, GA-18 is going to go in effect, which begins opening up Texas in phases. It does not affect essential services. All of the essential services are still operating under the same guidelines as they have been throughout all of the governor's executive orders. However, under GA-18, the governor's added reopened services to those services allowed. Those services include, as the mayor said, in-store retail, dine-in restaurants, movie theaters, shopping malls, museums, and libraries. For the first phase, reopened services must operate at no more than 25% of their posted occupancy. For more guidance and checklists, the governor has issued the Texans Helping Texans, the governor's report to reopen Texas document. It's an extremely useful document that provides a lot of checklists that can help you know exactly what you need to be doing, whether you're a business owner, an employee, or a customer. And that can be found at gov.texas.gov /organization/open Texas. It's an extremely useful document. We have it posted on our website as well. That's all I have, Dave.
Thank you, Jared. At this time, we want to go ahead and open it up to questions from our media. If you have a question for a specific member of the panel, feel free to address it to that person. Or if it's just a general question for the entire panel, that's also fine.
And we'll continue with the coronavirus coverage on air and online. To keep up with the latest, you can visit our website at myhighplains.com. For now, let's go and send it back to programming.
related to medical statistics through employees and resident infections?
We do have, there are cases in several of our nursing homes. We do know that, again, each time people are in groups, that increases risk. And so we want to make sure that that we have a safe environment for both the residents and the employees. Dr. Milton updated his public health order and gave very specific guidance to nursing homes, and that, I believe, is helpful.
Thank you. And has there been any increased activity on the city's part to address the needs of the homeless during this pandemic?
Yes, absolutely. So Juliana Kitten and her team at Community Development have done a wonderful job supporting the shelters, who also do a wonderful job in supporting their clients. So yes, absolutely. And they have a wonderful plan in place. So if someone who is homeless or experiencing homelessness goes to the hospital, tests positive, becomes symptomatic, then there's a plan in place so that they can stay safe in a hotel room. They have worked very hard at the very beginning of this situation to create space and to alleviate some congestion there in the shelters. And so that has that's done a world of good in our homeless population.
Perfect. Thank you, Casey. And this one's probably for Mayor Nelson. Why did the City Council not consider the alternate care facility proposal yesterday?
I'm going to talk just a minute on homelessness, and then I'll talk about alternate care facility.
Yes.
I'm so pleased with the job that Juliana Kitten and her team have done. We have had a few positive cases in our neighbors who are experiencing homelessness population, but they've been quick to isolate them, provide hotel rooms for them to quarantine in. They've done a great job being in front of the population in one shelter in particular, trying to move out the women and children into hotel rooms. It was a massive effort on their part, and they funded that with department dollars. And so that facility could become a men's only facility, and it allowed them to use the entire facility to spread people out. And I do believe that has made a difference in keeping them 6 foot distanced and not as crowded in there. And many of those women and children that were moved temporarily into hotel rooms have gone into the Coming Home program and are looking at receiving the benefit of permanent housing. And so it's not just that they addressed the COVID situation that was immediately in front of them, but they actually stayed true to their mission, and that was trying to get those people into permanent housing. So I could not be any more proud of the effort that they've put into it. And they have worked so hard, just as the health department, the communications department, so many people have been working extra hours during this COVID response, very much so behind the scenes. The community development team has been working extra hours in order to cover all the bases that they could see needed to be covered. And so I'm very proud of them. The alternate care facility was on our agenda yesterday because initially the city was going to use some of their COVID response dollars to stand up that facility. As our numbers continue to grow, and this is just such a fluid situation, it's changing every day. From the time that went on the agenda and it was published over the weekend, and then time for City Council to consider it yesterday, our situation changed, and the state came in and partnered with our hospitals to provide that alternate care plan and alternate care facility and the funding for it. So that's really good news for us as a city. We appreciate the help that we're getting from the state. But just as that situation changed, that agenda item was no longer necessary. It does not mean that we have gone away from planning for an alternate care site facility. That plan is very much so in place. But I have been on the phone with our hospital CEOs in the last 4 to 5 days, more than once. And I can tell you that we really believe that is a plan of last resort. It's not looking like we're going to need it right now. It's there if we do need it, but there are lots of other plans we would trigger and put in place to try and treat those patients before we would do an alternate care facility. And the hospital doctors may have something to say about that, but just in addressing why it was on the agenda, but we took no action on it. The situation is fluid. The state stepped in and gave us a better offer. And so we did not need to take action on that item yesterday. Anybody else want to add to that?
I would just say, first, I do also want to echo with Juliana Kitten and her team. They've been an invaluable resource to the hospital and have been immediately responsive whenever we've had a patient experiencing homelessness who was COVID positive. So they've done a phenomenal job. I think the alternative care site, yes, both hospitals have worked very hard at internal surge plans. We've also considered some of the post-acute facilities like skilled nursing units and long-term acute care facilities. So there's a multi-tiered plan. None of the options are turnkey in that sense. Every one of them represents some kind of challenge, whether it be the availability of PPE at some of these other facilities. But bottom line is, I think that both hospitals have a significant capacity right now based on internal planning. And yes, I agree with that. The alternative care site will be a last resort if need be.
Perfect. Thank you guys for explaining that.
Dr. Lementier, do you have something you want to say about that?
Yeah, thanks, Mayor Nelson. I'd like to comment too. I agree with what's been said, and that is that we need to really look at the infrastructure that's been in place in our community long-standing, that has been equipped and trained and capable of handling patients in the post-acute setting, and how we can support those partners in the post-acute setting in terms of strategies about how to handle COVID patients, in terms potentially of what we can do with PPE resources before we get to the alternative care site, which again should be the last resort. And we're having very frequent phone calls. We had one again this morning in a very collaborative way to discuss how we can work on those opportunities and what they would look like. So I feel good about what we're doing in terms of the plan. The hospitals have significant capacity still at this time in terms of our internal surging. But beyond that, we need to continue to have collaboration with the current infrastructure.
Perfect. Thank you. And for either Casey or the mayor, that list that you mentioned that you're sending to the governor, what's on that list to help with our cases?
Sure. So we're working to finalize that list, but the draft right now contains testing supplies. So not only the traditional testing supplies for PCRs, but also to support the hospitals and other healthcare providers in that in-house testing. So we want to make sure that capacity is robust. We are asking for supplies and needs for the alternate care site and also to use in the hospital so that we may not need to go to the alternate care site, for additional testing supplies, for the public health testing clinic that we have for the community, and then of course PPE. And so that's kind of the basic framework of the.
Does it also include some extra helping hands, Casey?
Yes, ma'am. So it would include
additional contact investigators.
Yes. So all of those supplies require people behind them, and so we're asking for contact tracers, for nursing staff, for the support personnel to operate all of that equipment.
Perfect. Thank you for explaining. And the very last question. Does the city have a plan for if Amarillo has a surge of cases after reopening?
Yes, and this is the alternate care site and the plans in place that we've talked about would be that plan.
Thank you.
Thank you, Ariana. This time I want to go to, if I'm not mistaken, Aaron Langston, KAMR Channel 4. Aaron, how are you? Aaron Langston, KAMR Channel 4, if I'm not mistaken. How are you, Aaron? Okay, we'll move on. Hey, we got you. Aaron, how are you? It happens. How are you? Good.
I'd be happy to take some of it. So again, that's all part of this process of if we were to happen to need an alternative care site, how would we staff it? Because at that point, you know, both hospitals would really be at their fullest capacity. So that's the idea is that we, you know, there are a number of healthcare providers who may have found themselves, you know, in slower shifts and things like that. So we want to get that registry out there so we have that ability to recruit some of these caregivers, like Dr. Lamentier mentioned, they're highly trained professionals to be able to man an alternative care site if that were needed.
Sure. Excuse me. As far as the rest of the year goes, we're estimating somewhere between $8 million and $12 million negative impact on sales tax revenues, and then also significant impacts on hotel occupancy. Easy for me to say, hotel occupancy taxes. We have made a number of steps to be able to accommodate the losses in revenue from a municipal standpoint without, we don't project having to do any property tax rate increases associated with this next year. We've done those savings through modifying our capital improvements program, freezing all hiring, modifying operations, closing a lot of operations. For example, a lot of things out in the parks area and in the streets areas. So there's been a lot of projects that we have postponed or canceled, and then a lot of hiring that we're not doing. We've also been modifying operations at all of our city facilities. So we have a plan to be able to go through the rest of this fiscal year, and then we're going to be, we're working with council. We'll be working with council, and we're also forecasting right now steps that we're going to need to take going into the next fiscal year to be able to budget for that and make sure that we can have a flexible enough budget to be able to accommodate what is right now an unknown situation as to how the economy is going to respond beginning in October of 2020.
Aaron, I just want to add in that, you know, citizens want to know how this is going to feel, how it's going to land on them. And the interesting thing about a worldwide pandemic is it touches everyone and it affects everyone. So all citizens will feel the effects of lower revenue in the city budget. And it's mostly going to touch us in our summer programming for Parks and Rec Department. As it's working right now and still to be finalized, but you know, it's looking like we won't have the summer recreational activities that we're used to having in the city. The budget response is real. And we recognize that we cannot make up that difference by asking people to dig deeper in a property tax increase right now. So what that means is we have to find a way to make the budget work by cutting services. And those services are, they're vital, they're important, and we value them, but we're not the fire department, we're not the police department. So they're the services that are most readily available to cut. Something else I wanted to say, on the hot tax, I want people to understand that as we're currently projecting, even with our decrease in hot tax revenue, we still have plenty of coverage to cover the payments on the ballpark and the parking garage. That's we have debt obligations that we use hot tax revenue to pay for those two facilities. And even as we have revamped those numbers, we are not worried. Council has been presented those numbers, and we are not worried about meeting those debt obligations. So I want citizens to be affirmed and not be anxious about that.
We have one positive in fire department. We've got 2 others that are being tested. I'm not aware of any positives that we have in the police department at this time.
And I can start with that. So the answer is yes. I mean, I've been in touch with some of the providers up in Moore County, also in Fiona, and they're doing an incredible job of managing what they can manage at their facilities. These are great facilities, but they're limited. But the doctors and nurses there are fantastic. But yes, obviously, most of them do not have critical care capacity. So when they get a patient who is on a ventilator or is critically ill, they're going to send them to either us or the BSA or the VA of the veteran. So yes, so that does impact us, and that's why I've talked about the fact that we really don't need another hotspot in that sense. Is we are using resources to support these other communities, and Amarillo right now has done a great job of kind of keeping it low level, and so again, that's why we're asking the citizens of Amarillo to follow the guidelines of the mayor and Dr. Milton and practice all those practices so far that have kept us at a low level of activity in Amarillo.
Oh, blue skies, Jared, you're muted.
Jared, we got you muted.
Jared.
There we go.
From a municipal standpoint, we're going to be working with the Environmental Health Department as well as the Fire Marshal's office to work with businesses to help them make sure that they're observing the rules issued by the governor. We're also going to be responding to calls if people have concerns, but we'll be out there proactively working with as many businesses as we can.
Thank you, Aaron. This time we want to go to David Gay of the Amarillo Globe News. David, how are you?
Good morning, everybody. I guess the first question that I have is, a couple of times, I believe it's been Dr. Weiss and maybe some others have mentioned that we can't have another hotspot. And we've talked about this a little bit through the conference, but I just want to ask, can you talk about, what precautions are being taken to make sure that what happens on Friday with the businesses reopening, what precautions are being taken to make sure that a business that's reopening on Friday does not become a hot spot for the COVID virus in the area?
Well, from a city standpoint, we're going to be working with them to help make sure that they're observing the rules issued by the governor. Very detailed checklists and things. Can it be 100% effective? Nobody knows. But there are very thorough checklists. So we're going to work with the businesses to help them make sure that they are observing everything possible on those checklists.
I think another response from the city is that we're increasing the data that we're providing to citizens on our dashboard that will hopefully be coming up that same day. So citizens can be very engaged in watching what our numbers are doing. And if you're a business owner, we're asking for you to responsibly open if you can responsibly open. And if you can't, we're asking you to gauge what's best for you, for your family, your employees, your customers, and for our community as a whole. So we want to empower you with as much information as we possibly can about what's happening with our numbers, both hospital capacity and outbreak, the positive cases and active cases. And so it's going to be a partnership. Very much so a partnership in how our city responds, and we'll all be watching the data together, and we'll all be making responsible choices about how to respond to it together.
Absolutely, absolutely. And I guess for the medical professionals on the call, talk to me about this increased use of ventilators And what do you guys have projections of? Will it be increasing in the next few days? Is there any way to know that? And what precautions is the hospital taking to make sure that the ventilators aren't the use can be decreased in the next few days?
So sorry.
I can start with. Go ahead.
Go ahead, Mike.
I was going to say that, I think that it's critical to reiterate that we have surge plans that are allowing us to use ventilators with devices that have not been traditional ventilators. They're perfectly safe to utilize. There are things like anesthesia machines, which function as ventilators when people are having surgeries, for instance, or BiPAP machines, which are devices that we use as a traditional non-invasive ventilator. So there are things that we can do to significantly augment our capacity to use as ventilators for these patients, which I think is a little bit misleading when we first talk about what our current capacity is. That's really talking about the historical traditional vents that we have. But it's critical for us to make sure that we're attempting to have patients come off the ventilator promptly, and our physicians are doing an outstanding job of that in terms of managing the non-COVID patients and appropriately trying to get them off the ventilator as quickly as possible, which they do on a daily basis and they're very good at. And also now attempting to not put patients with COVID positivity on the ventilator unless they absolutely must do so. The literature now is a bit controversial in terms of what we should be doing in terms of the timing of putting someone on a ventilator that has COVID. So we're trying to do things, obviously, before we get to that point where we have to put someone on the vent, which, and no question, once we do that, patient's prognosis is not as good, and that's just being frank. So we're trying to minimize our ability to do that. When we do have to use a ventilator, trying to have that time on the vent be as short as possible. But this difficult disease process in terms of how we manage those patients is making that a little bit more complex.
Yeah, I would definitely echo what Dr. Lamentier said, in the sense of we know if we can keep the patient off the vent, that is in their best interest. And so, we're even doing things like Blackbird is almost turning patients upside down, in a sense that most patients are usually lying on their backs in the ICU. We now know there's data that if we can turn them at least part of the day onto their stomachs and to their chest to breathe, that helps keep them off the vent. And that these are lessons that have been learned up from New York City. The other thing is, besides the ventilators, as Dr. Lamentier mentioned, we have anesthesia machines. We even have these little transport ventilators. The trick is a COVID patient, when they're on the ventilator, needs all the bells and whistles that a true ventilator can provide. These are tough patients to manage on a ventilator because of the severity of their lung problems. So we're also trying to take patients that may be trauma patients, or patients who may not need all those bells and whistles, and put them on maybe the simpler machines to try to preserve some of those true ventilators for the COVID patients. So yeah, there's room here to wiggle in a sense of capacity that we have to utilize, but the name of the game is if we can keep the patient off the vent, their prognosis is better, as Dr. Lamentier mentioned.
All right, well, thank you guys for your thoughts, and that's all the questions I have. Thank you, Dave.
Thank you, David. Just to make sure we don't miss anybody, I think we have a representative from KVI Channel 7, Brandon Carpenter. Just want to make sure we don't miss anybody. Brandon, are you there?
No question.
Okay, thank you, Brandon. That was all the media questions we had for today. That wraps up today's COVID-19 news conference from the city. I want to thank all our panelists who participate in this. We do this 3 times a week, every Monday, Wednesday, and Friday at 11 a.m. Once again, thanks everyone for the participation. This is David Henry. I'm the Communications Manager for the City of Amarillo, and we'll see you Friday. Thank you.
Thank you.
Thank you.